Dr. Eileen Davila joins me now with the latest in the COVID fight here in the city of Toronto. Good morning to you, Dr. Villa.
Good morning.
All right, so let's begin with the bylaws. And really no surprise in that we should be extending this when we look at those numbers right now. And why that June timeline? Could we see it go earlier or later, or is June just sort of a placeholder?
Well, I think we wanted to make sure that we were giving enough time for the bylaw to be in place and to exercise that degree of caution. You will note, however, that in the report, we're also calling for a regular review, which of course we would do at Toronto Public Health on a monthly basis to make sure that, one, we're assessing constantly what the situation is, and two, adjusting our response in accordance with what we're actually seeing on the ground.
Okay, so let's look at what we are seeing here with the City of Toronto. Public Health yesterday reporting well over 700 new cases, 14 deaths, and interesting to note when it comes to the UK variant, 14 detected of this variant here in Toronto. How concerned are you with that?
Well, I'm definitely concerned about the variant, as are public health officials all over the world. And the reason for this is that our understanding of these new variants is that they have increased transmissibility associated with them. So they spread more readily from person to person, and therefore have that potential to cause greater illness. So I think that's a reason for concern for us, as we have seen some success of our measures, and we really want to see our population continue on with those self-protection measures to keep their distance as much as possible, stay home as much as possible, so that we can bring the spread of this disease down.
Doctor, some of the visuals that we just showed there, that was of the Canada Post facility in Mississauga, where, of course, we're seeing a number of infections, and sadly, a person has lost their life as well. This does bring to question the idea of workplaces and where we are seeing this virus being transmitted. Can you speak to that? Because I know you have been pushing for paid sick leave, and where you're seeing the transmission in workplaces has been a big problem for us.
Well, we do know that, to the extent that people can reduce their interactions with each other, the more likely we are to reduce the spread of COVID-19. There are, of course, some lines of work where that simply isn't possible, where you need to do that kind of work in person. Healthcare, grocery stores, and clearly places like Canada Post that provide us with mail are the kinds of workplaces where, that work really does need to be done in person. The issue is that we need to create supports to the greatest extent possible as a society to make it possible for those who have to work in person to do so, and to do so safely. So part of that is ensuring that they've got good infection prevention and control standards and practices. And of course, the other part is what kinds of supports do places need in order to ensure that workers can stay home if they get sick or they've been exposed to COVID-19, so as to minimize spread.
Dr. Davila, when a lot of people that I talk to say they've been turning off the news lately, they just feel inundated, they feel exhausted. And then the follow-up question is always, who is being infected? Obviously, we're seeing infections in long-term care homes, and it is sad to see the spread. But when we look at the community, are we looking at possible infections spread through riding the TTC? Are we seeing, is it the backyards? Is it the get-togethers? People, I guess, just want to know where this is all coming from, because everyone feels like they're doing their part. A lot of people that we speak to say, I'm doing everything I can, but still these numbers continue to persist.
Well, actually, Mel, I think we should look at the numbers in the last few weeks, and those that were presented by our provincial counterparts yesterday indicate that what we're actually seeing is that as people are increasingly staying home and increasingly maintaining their distance, we do actually see a decline in cases. However, we know that we've got these new variants of concern. They do transmit better, as we understand. So all the more reason to continue to be vigilant about keeping our distance as much as possible. We know that this is the first line of defense when it comes to preventing the spread of COVID-19. So whenever we are seeing spread, where we are seeing cases, it's related to people actually coming into close contact with each other. And so that's why the message continues to be, wherever possible, maintain your distance. Stay home as much as possible and limit your close contacts, really to just to those with whom you live. That's the best thing we can all do. I know it's frustrating. I know it's difficult. But, we are almost there. We've got vaccines coming along, and we'll give those vaccines the best chance at helping us get through this by actually trying to reduce our interaction and keep our distance as much as possible for now.
Yeah, that is the light at the end of the tunnel. Let's hope we can expedite some of the inventory getting to us, because we need to get those shots in the arms. Dr. Eileen de Villa, thank you for taking the time today. I know you've got a busy schedule. Have a great weekend.
Thanks, you too.
Thank you. All right, 7:10 is your time right now. Devo Brown, we're over to you.